In the first week, in addition to what we have already discussed, I will just summarize. There is a breastfeeding pattern, there is a sleep pattern, there is a urine pattern, there is a stool pattern, हर चीज का pattern. But at the same time, all of these patterns are unpredictable. What we are basically trying to say is that in this unpredictability lies the range of what we call normal. And what one needs to figure out is that there are certain situations in which we don't want you to presume that things are normal. So how do we do that? First thing is that the baby is overall well if the baby is feeding, passing urine, passing stool. A baby who's demanding excessive feed is 99.9% not sick. A baby who's not demanding feed is more likely to be unwell. So we are more worried about the baby who's not demanding feed, not passing urine, not passing stool, rather than the baby who is excessively hungry and crying. While most often 90% of the mothers will come out to us with complaints that the baby is crying too much. Right? Now let's talk about this crying too much. So when the baby is crying too much, of course you need to figure out the general reasons. General reasons can of course be hunger. It could also be inadequate burping, right? Which you will make out only of course the next day morning, because the baby hasn't been burped well in the night. It is difficult at 1 a.m. with a meeting tomorrow. But at the same time, the overall context of things is that temperature, too hot, too cold, soilage, some kind of irritation somewhere, some rash, some pain. These are also common reasons for the baby not feeling comfortable while sleeping, and could be a reason for excessive crying. All the baby knows to express discomfort is crying. Another common reason is nasal block. If there is any kind of even minor cough, cold, sometimes the baby will get nose block and therefore be excessively irritable. Now, in addition, there is this important question of colic ho gaya. Right? You get that? I was not clear. Colic? Yeah? We all love the word. It is one of the most common reasons for pediatrician consultation. And lots of pediatricians worldwide make a lot of money out of the word. Colic. हाँ, पेट में दर्द हो गया बच्चे को. ठीक है? Right? So, gripe is also a word which is used in that context. So, a lot of pediatricians worldwide make a lot of money because of colic. But what is colic? In medical definition, colic is inconsolable crying on 3 separate occasions for more than 1 hour in a week. Does that make sense? Right. So we are experts at making terminologies. But at the same time, finally it doesn't make any sense to the layperson. And that is the basic intention. Now, the idea is that a baby who is breastfed exclusively, who is burped well, and we haven't done anything wrong with the parenting, why should such a child have pain? मतलब भगवान की ऐसी क्या दुश्मनी थी कि ह्यूमन के बच्चे को ही पेट में दर्द होना था? कुछ ना कुछ तो गड़बड़ होगा. मतलब something either we are doing wrong or it is a bloody mistake of nature that it has created such a problem that every child is going to require some sort of gripe water or medication or colic aid or something to just maintain normalcy. ये कैसी कार है जिसमें रोज तेल डालना पड़ता है? Doesn't make sense, does it? Right? So the overall context in things is that colic, although it is a very important parental concern, medically I'll give you certain facts. In general, the incidence of colic is 1/10 for mothers who have second babies. That has a very important insight, which is that every unexplained crying is actually labeled as colic. As the mother gets more experienced, बच्चे का तो कोई नया experience नहीं है, वो तो अभी पैदा हुआ है ना? How can the second baby have less colic? नहीं हो सकता. As the mother gets more experienced and nuanced at handling the baby, usually they are able to decipher the reason for this crying better, and therefore colic is less. So what I am trying to say is that basically one needs to rule out each of the above checklist causes कि ये इस वजह से रो रहा हो सकता है, and the best way to rule out is to ask the baby. कैसे पूछेंगे? भाई क्वेश्चन ये है कि ठंड लग रही है कि नहीं, एक लेयर ज़्यादा पहना के देख लो. If the baby is crying because of that, baby will be comfortable. क्वेश्चन ये है कि गर्मी लग रही है या नहीं, तो थोड़ी ठंडी जगह में ले जाओ, कपड़े कम करके देख लो, तो पता चल जाएगा कि भाई उसमें ज़्यादा कंफर्टेबल हो जा रहा है कि नहीं. राइट? सो दिस कॉन्टेक्स्ट, हाँ, that will, there will be noisy breathing, there will be what you call, when you put the child on the shoulder, there will be this ghad ghad sound which keeps coming, resonating with you when the child breathes. So it is not so difficult to figure out a nose block. Of course, the basic this thing also you will notice is that they are slightly comfortable left alone. When you attempt to feed them, they will start crying. Because अब तो मुंह तो खुला था, अब तो मुंह में बंद कर दिया. ठीक है? So that is something which is more of a thing that you will also kind of appreciate as you see, because nose block तो कभी ना कभी तो जुकाम होगा बच्चे को in some context or the other. So where were we? We were on colic. Now in colic, the other aspect that is important is that most often the incidence of colic is much higher in those who are fed mixed feeding. Exclusive breastfeeding है तो chances कम है. If you have a context of formula feed being mixed with bottle fed babies, have anyways higher chance compared to breastfed babies, because aerophagy, which is swallowing of air, is much more in bottle fed babies, right? So in bottle fed babies, burping is 30 minutes. ठीक है? Right? Of course, it is not to say that it is something like condemning the bottle fed babies or something like that. What I am trying to say is that you need to be much more careful in that context. Sterilization is another important thing in bottle fed babies that you need to be very, very careful about, because sterilization is one thing where 1% chance is not acceptable. Why? Because bottle is to be used 10 to 12 times a day, which means 1% का मतलब 10 दिन में एक बार तो गलती हो जाएगी. अब 10 दिन में एक बार गलती होगी तो 10 दिन में एक बार अगर इन्फेक्शन होगा, बेकार है बॉटल फीड ही कराना. Right? So 1% error is not acceptable, and advice is that you try and use steam sterilizers and you try to sterilize 2-3 bottles simultaneously, because what is going to happen is that रात को 1 बजे अगर बॉटल हाथ से गिर जाती है स्टेरिलाइज्ड वाली और बच्चा रो रहा है, I don't think any of us have the patience to re-sterilize with a crying child howling down your throat. ठीक है, तब यही होता है, यही पिला दो भैया, अभी कुछ नहीं पता. ठीक है? So interesting, the first week patterns we already discussed, colic we already discussed. There is also certain normal events that happen at this time, which are exactly, good question. Answer is that there is no medical consent for starting it ever. मतलब जब आपकी मर्जी हो तब आप स्टार्ट कर सकते हो, but at the same time, हाँ, अब ये है, now that's a slightly different thing. You see, when you can start normal milk is a slightly different question. ठीक है, you can start normal milk at 1 year as a drink separately, Breastfeeding can be continued for 1 year is the optimal duration, optionally up to 2 years. But that doesn't automatically translate to bottle feeding. At 1 year, you should transit to feeding from glass or sipper or whatever. I mean, bottle doesn't come in. Huh. So,
I just want to know, like, there are various like NAN, MAN, NAN, like there are several kind of NAN are available in the market. So we can use that, or we can use. It's better to use cow.
so, formulas are an attempt of the human mind to mimic the breast milk as far as possible. So they are the closest composition that there is. Okay. Now, cow's milk, buffalo milk, and whatever other animal milks can be used as a substitute in only one context, which is that where affordability is a concern. So that kind of summarizes. Basically, the idea is breast milk is best, next is formula, next is animal milk as far as. There is an important caveat to this, which is that somebody might say कि why? मेरे घर में तो अपनी भैंस है. अब देखो ऐसा है कि overall the health of the baby is dependent on several micronutrients which are specified up to a particular amount limit in the formulas, and there are gross guidelines and recommendations with reference to those formulas. Okay, so इतना कॉपर होना चाहिए, इतना मैग्नीज होना चाहिए, इतना कैल्शियम होना चाहिए, इतना आयरन होना चाहिए, वो सब स्पेसिफाइड है. In the overall context of things, we don't want the health of your baby to be dependent on the health of the cow. ठीक है? I didn't get that?
Enough said, I think.
Okay. So that brings us to jaundice. First few days, 1 or 2 days, there isn't any jaundice. In the first couple of days, in most of the babies, with the exception of few medical conditions, which include RH incompatibility and your blood group incompatibility, basically. Now, the second, third, fourth day, chances of jaundice increase, and commonly around 70% babies have some jaundice. Again, did nature make such a mistake that सारे बच्चों को jaundice हो रहा है? Answer is very simple. Nature intended the babies to be in sunlight. The intention was not to keep the babies indoors. Human beings' health to a very large extent depends on exposure to sunlight. Starting from day-night pattern and normal hormonal releases in the context of day and night, there is also the context of vitamin D synthesis, and there is also the context of newborn jaundice. So overall, exposure to sunlight is very critical, and starting from day one, an hour in the morning, hour in the evening, ठीक है, 1 to 3 p.m. का period थोड़ा avoid करें, that is where the slightly harmful kind of this thing is there, but morning, evening are good times for sunlight. There is an interesting story behind this, which is that the treatment of jaundice is phototherapy, which is blue light. If somebody gets excessive jaundice, we keep the baby under blue light, which is the treatment. 24 to 48 hours the baby gets fine. So did somebody get this brain wave that blue light के नीचे रखने से baby ठीक हो जाएगा? No. It was based on a very simple observation. There was this earlier there used to be huge long boards. I don't know whether you've been to some of the old traditional hospitals. There were these long wards running for half a kilometer, and there used to be beds in serial kind of numbers. So there was this kind of a nursery in one of the European countries, and one of the sisters, she observed that babies who were kept on the non-sunlit side of the nursery used to get jaundice more in comparison to babies who were on the sunlit side. So this observation led to this treatment, which is phototherapy. That doesn't mean that baby को jaundice हो गया तो इलाज करने के लिए sunlight में treatment करेंगे, because it's a very slow and relatively ineffective method. The blue light is much more effective and faster, but at the same time that means that sunlight is protective against jaundice.